And I would like to welcome Samit Shekhar. Kamal would request to give a bouquet.
Welcome for joining us today.
And we welcome Dr. Kiran D. Shekhar. Kamal to give the bouquet. We welcome Pratima Gova ma'am, doctor.
Thank you so much.
So we are delighted to host this session, and we look forward for an interesting session. Thank you. Now we'll hand it over to Deepal, our editor response, to take it forward. Thank you very much.
Thank you. You know, I think Mother's Day, more than any other day, connects the world in ways which probably transcend every other identity, whether it's religion or, you know, your national identity or your geographical identity, because the concerns are very close to the heart. And even as medical technology keeps advancing, there is a whole plethora of emotional questions, psychological questions, social questions, which keep revolving around this super speciality. So really there isn't anything more befitting to do on Mother's Day than to share everything that's possible. And so I'm so super thrilled to have senior people like you, people who've seen it, done it all. And Dr. Kiran Shekhar, we've heard so much about you, so looking forward to all your insights. And you know, I know that when you were the VP of Foxy, you must have picked up immense understanding of the subject, with thousands of doctors and super specialists with you, under you at the time. So your revolutionary work and the insights you drew from it, we really would love to share with our readers. And Dr. Pratima Grover, we've heard that you are really obsessed with all the evidence-based protocols, you know, and you have taken this entire process-based super speciality far ahead than it used to be. And honestly, I think women, when they approach an IVF center, they really want, it's like putting your whole life into somebody's hands. You know, it is so big a moment. I mean, people talk a lot about the finances, but I'm just talking about the emotional side. It's so huge. So I think this obsession that you have with protocols and processes and doing everything exactly bang on right, your education at the Cleveland Clinic, I'm sure would have enhanced this entire understanding. So looking forward to all your insights on that. And Dr. Samit Shekhar, as owner and director of Kiran Infertility Center, your leadership in IVF programs, your understanding, I mean, your education and specialization in the men's health and andrology space, I think that is the other half, which often does not get discussed at all. So it's incomplete knowledge. So today we are really looking forward to a robust discussion which is complete. And after reading the story, I am sure our readers will feel confident and sure about how to take forward their own motherhood plans. So thank you. And we dive right in. We were just talking before we came up about how is IVF looked upon today as a treatment? Have you seen a shift in the way women look at it, from difficult to approach, can I tell my family I don't think I'm going to conceive naturally, to should I just go to the IVF center and speak? Ma'am, how have things changed? You've seen this over many years.
You started with a very relevant question. Actually, when I started this journey of IVF in my career about 25 years back, patients, used to come with little bit of a hesitation and some doubts in their mind about shall we go and directly ask for IVF, because they used to consider it some kind of they used to think that either you take the gamete donation or something like that, and the whole society would think that they went for IVF means something must have been wrong with the
you feel like you're flawed somehow.
Yeah,
your body is not up.
Yeah, some flaw was there either in husband which was not told to the in-laws and to the wife's family, or wife had some problem and it was not told. So they used to sometimes come and say in private also, madam, I will send another patient, but don't tell this patient that, you know, I underwent an IVF with you. Just say I conceived by a natural method, you know. So from there I have seen a, you know, very big shift. Now actually they come directly ask you, we have gone through all these procedures, we have had this much failures, we have had IVFs in other centers, we have had failures, and you know, this is all our investigations, our history.
Yes.
And even the husbands are ready to admit that my count was low, or it was, you know, the sperms did not have motility. So every kind of report they are ready to discuss with us. So as you put that question, you know, like now I have seen a lot of change, but still some patients, you know, are a little hesitant and all, but I think it is mostly taken care of.
That's just so good to hear, ma'am. That's so good to hear. So the other half of this thing, the whole social norm, was that forever we had women who were looked upon as, you know, is she capable of having a child or not? Like as if it was only the women. So I really have to ask Dr. Samit, why is it that the men in India don't even think that it is possible that they could be the other half of the issue?
At the onset, I would like to thank the Times of India and you personally, the editor, and Reshma and the team for having us here and having this discussion on a very relevant topic of our times. Coming to your question, ma'am, what we discussed earlier informally, you know, that men always equate, or some of the men at least, tend to equate virility or their performance in the bedroom with fertility, which are two totally different things. So when you look at science and the numbers, 50% of all infertility cases are attributable to the man and 50% are attributable to the female. So that's a big incidence, and I think the awareness about this is increasing as people get more educated. But programs like these will also help, you know, initiating that discussion within the fraternity of men, that, you know, they could also be one of the reasons for not having a child.
So is it that in your counseling you insist that the husband must come along with the woman?
Yeah, I'll take this one. Yes, we usually prefer both the couple to come together, you know, when there is a counseling session. Usually the woman comes in first and gets her investigations done, but we definitely want the husband to be together because the counseling is for both of them. And investigations also, the male partner has to come in. It's always better when both of them get investigated together and counseled together because, you know, there is where you completely show them the correct picture. It's about counseling about what's going wrong where. Why have they not been conceiving for so many years, and what is the diagnosis of, you know, the infertility right there. And then how do we carry on this, you know, ahead. So all these things, if both of them are there, indeed, you know, with the husband, there are in-laws also coming in now.
Yeah.
Sometimes the in-laws also join in. But then husband, yes, it's a must that they should come. And nowadays men are, you know, coming in with the lady and they don't...
More open mind.
Yes. I think that's something which women are asserting on men nowadays, you know.
Nowadays.
That if you don't come, then, you know...
It's not going to happen.
Yeah. So that thing is, assertiveness is very important, and that's happening in the society now. Now women feel that, okay, it's just not me, it's you too. So you have to come in, and instead, you know, sometimes they say, pehle inka karao, you know, get his investigations done.
Yeah.
Because I've had enough.
Yeah.
You know, I've had enough.
Trying.
So,
Yes.
so that's how they come in assert, and then they realize that if this has to work, obviously the marriage has to work, then he has to realize that, you know,
Yes.
this is very important.
Absolutely.